So for all of you who are unable to view the screen with us today, my PowerPoint presentations are very basic. They're all black text on a white background. Occasionally I'll use a different color text and I will verbally prompt when and why that occurs. In the upper left corner, we have the icon for all of our Stop EVV New York State Coalition. This is an image of New York State in black with the wheelchair accessibility symbol in white overlaid and a red magnifying glass on top with New York written underneath. So today we're going to go over electronic visit verification, EVV. Some of the solutions, those are different types of EVV systems that are out there, some current concerns from the consumer community, as well as advocacy steps that you can take to feel empowered after leaving here to talk about EVV with some more confidence. As I mentioned earlier, Stop EVV is peer-led and a peer-run campaign, and we support people with disabilities in their right to maintain privacy and dignity in their home care programs. So on the national level, we advocate to end some of the harmful components of EVV, like GPS tracking and biometrics. I'll discuss that later. And on a state and local level, we help to build coalitions with local leaders and guide them on what their state policy looks like. So today we're going to go through a little bit about what New York State policy looks like and what the federal guidelines also look like. Our goals today is really to understand what is electronic visit verification. We're going to go through some definitions, some of the jargon that we use within EVV. We're going to review different types of EVV so that you can feel a little bit more comfortable when you start talking about these or having to use them with your agency or fiscal intermediary. We're also going to review some federal law as well as the New York State policy. We're going to identify some of the potential harms that consumers and personal assistants feel come from EVV so that you're prepared to talk about these issues. And we're going to learn about different advocacy opportunities, such as working with your agency or fiscal intermediary to choose EVV solutions, how to delay EVV implementation potentially, and how to change the federal law around certain requirements that just aren't feasible for our community. I'd like to start out by first going over a definition of EVV. This is a definition that consumers have come up with. Electronic visit verification can be very complicated and confusing, but I really like this definition. It really helps to understand exactly what it is. So EVV is a method that uses technology to gather information and capture when someone worked. So essentially, you're just using some sort of technological device, such as a phone or a mobile phone, a computer, or other devices that's going to let someone else know when your personal assistant or home care worker came to work. So here are some of the definitions that we all need to understand to really get through this presentation, but also how EVV will impact our lives. The first definition is biometrics. Biometrics is using technology to capture biological or physical data that is used for identifying and accessing certain types of information. So types of biometrics can include fingerprints, facial recognition software, eye or retina scans, voice verification, and other types of devices. So essentially, it's taking information that your personal body creates that can't really be recreated, or in theory should not be able to be recreated by someone else, to identify that you are who you say you are. GPS, or Global Positioning System, this is something that many of us already use today. It's a navigation system that uses satellite signals to identify the location of an object on Earth. So if you've ever been driving and you're turning on Google Maps or some other device or app to help you get from where you are to where you're headed, that's a GPS system. So it is tracking where you are at every moment that you are using that device. Geofencing is the use of GPS to create an imaginary boundary or perimeter around a location, such as your house. And the way that this is used in electronic visit verification is that some vendors or agencies have geofencing fixed, which means that if your device demonstrates that your location is outside of a certain radius from your home, it's gonna ping that, that visit and kind of just put it back and say, this is questionable, were you really at your house when this visit occurred? We also are going to look at HIPAA, the Health Insurance Portability and Accountability Act of 1996. This is a law that provides privacy standards for patients' medical records and other health information. Now, it's very important to note that HIPAA comes into play when this information is provided to or between health plans, doctors, hospitals, and other healthcare providers. So why do we have electronic visit verification in the first place? A number of years ago, in December 2016, the Congress created what is called the 21st Century Cures Act. This was a federal law that was signed under President Obama, and it was developed to speed up the development and treatment of medical products so that patients could get devices and treatments more quickly. And within the 21st Century Cures Act, lobbyists required a little section that makes all Medicaid-funded home care services and personal care services required to use some form of electronic visit verification in order to clock in and clock out. Within the Cures Act, there are certain types of requirements. And these are the most common ones that I have up on the screen here. This is that all EVV systems have to verify 6 different types of information. The first is the type of service being performed. Is it a personal care service or a home health care service? And CDPAP, or Consumer Directed Personal Assistance, falls under the personal care services. EVV must also identify the individual receiving the service, often called the consumer or the client. The date of service, the location that the service was provided at, and we'll get into how we define location a little bit later. The individual providing the service, such as your personal assistant or your home care provider, and the time that the services begin and end. Now, the Cures Act also requires some other items that are not frequently talked about. And this is really important as consumers and home care providers that we understand what these additional requirements are, because they provide us with protections. This is that states, or if states are choosing that their agency select the EVV model, then the agency must consult with stakeholders. Stakeholders are any number of types of people who have some sort of interest in the business and in EVV. So consumers, personal assistants and home care workers, staff members at the agency, these are all different types of stakeholders, and they're required to be included in discussions to choose and select EVV systems, to implement those systems, as well as to train with these systems. So it's really important that you remember stakeholder sessions are your right, and this is the vehicle through which you participate in the process. EVV is also required that states or agencies select systems that are minimally burdensome. They must also take into account existing best practices, and I'll go over a couple of those best practices later. The systems must also be conducted in accordance with HIPAA to ensure that your privacy is protected, and to ensure that individuals who furnish personal care services are provided an opportunity for training. In New York State, we have what's called the choice model. This is where each home care agency or fiscal intermediary selects an EVV system to use. And the agencies then become responsible for following all of the federal requirements. New York State also encourages flexible systems that are accessible for various types of disabilities, as well as systems that are HIPAA compliant, just reiterating that federal requirement there. New York State has determined that we can capture data without the use of an internet connection. So you can use it in an offline mode, and that later on, at some point when you are connected to the internet, you can upload the data later. New York State has also determined that location can be defined as home or community. So GPS is not a requirement in New York State. And the Centers for Medicare and Medicaid Services, CMS, the federal agency that oversees the Medicaid programming, has also stated in their federal guidance that GPS is not a requirement of electronic visit verification, and that the use of home or community to define the location is acceptable. So this is really important for individuals who might be concerned about their privacy and being tracked, even if it's a one-time ping at the start or the end of a session. For some people, they're very uncomfortable with having their location be identified and sent over the internet to a third party for any reason. So it's important that you remember that you do have the right to advocate for home or community rather than a GPS-based EVV solution. In New York State, we have also determined that live-in PAs are exempt from EVV use. So if your personal assistant or home care provider lives with you, that means they share the same permanent address as you. They are not required to use EVV. They can continue to use paper timesheets or another form of choosing their clock in and clock out. Now, I want to talk a little bit about unique considerations within the consumer-directed personal assistance programs, because it does work a little bit differently between a traditional agency program and CDPAP. And that is, under CDPAP, the consumer is the direct supervisor and employer. And so there's a lot of choice, control, and flexibility that's built into the requirements of CDPA that we all need to keep in mind. And maintaining our choice, control, and flexibility is key and integral to making sure CDPA continues to operate the way that it was designed. Under CDPA, consumers also have that supervisory role that I talked about. So when it comes to EVV, being able to review the timesheet every single clock in is really key. To managing your plan of care, to managing how many hours or minutes you have each week. So making sure an EVV solution that is chosen by your agency maintains your supervisory rights is important. There's free movement within the community. Of course, we're allowed to have services outside of our home. And so being able to access our community at will without having predetermined locations for acceptable electronic visit verification clock-ins is important. And again, those privacy rights regarding where you're located at all times. So I want to go over just different types of EVV. One of the most common types of electronic visit verification is called telephony visit verification. It uses a telephone, and essentially the provider is given a unique identification number. The consumer is connected with the telephone that is being used to call in to clock in for the shift. So this would be a landline phone at your home. It could be the consumer's personal cell phone. Different vendors have it set up differently. We do encourage that multiple telephone numbers are permitted on telephony visit verification solutions so that you can use cell phones, work phones, other types of phone numbers of locations that you're frequently visiting. That predetermined schedules are not required. On some EVV systems, a schedule of when you're going to have a clock in or clock out and who your provider is must be given to your fiscal intermediary or agency prior to the week starting. We really encourage that predetermined schedules are not required so that we can maintain that flexibility and autonomy over our lives. We also encourage that all telephony visit verifications and all EVV solutions maintain consumer access to review and approve the timesheets, especially under CDPA, where it is your right and responsibility as a consumer to review the hours, to review the timesheets, and to approve them and sign off on them. This is really key. And also that if there are any changes, modifications to a timesheet that need to be done, that this is not going to require third-party approval. So if you need to contact your agency in order to change time on the timesheet, it's really going to become cumbersome and difficult for everyone involved in order to get that done. So as much as it is able for these systems to be independently operated by the consumer and the personal assistant, the better. Now we also have mobile apps. Many of us are familiar with this. If you have a smartphone device, you're most likely using mobile apps consistently throughout the day. And so this is another app that you would download onto the mobile phone. It's typically put onto the provider's phone. So your personal assistant would need to have a mobile phone of their own with a data plan so that they can access the mobile app throughout the day. What we recommend with mobile apps is that the process to register is very easy to understand. So it should be quite simple when you open up the mobile app to input an email address, name, and a password, and be able to collect this information so that they can consistently log in quite easily. We also recommend that personal health information such as your social security number, your address, your Medicare or Medicaid ID number are not disclosed through the mobile app. There are concerns with HIPAA if this information is viewable on a mobile app, that if for whatever reason the information is targeted by a hacker or the phone is lost, that potentially that information can be disclosed. So having a mobile app where the EVV system does not have that information, the personal health information on it at all, is really the best solution. We also recommend that mobile apps do not use GPS tracking or biometrics. For privacy reasons, there are some consumers and also some home care providers that like GPS tracking and are comfortable using biometrics. And of course, that is completely up to them to decide. But from Stop EVV's standpoint, the GPS and biometrics go into an area of privacy that once it's required for everyone, we really feel that it's unfair and potentially unconstitutional. And lastly, it's really important that mobile apps are accessible to a variety of different disability needs, as well as different types of software on mobile phones. So some individuals may be using accessible software on their phones to help them interact, and the mobile app for EVV should be able to be compatible with those different software and devices. We also want to be cognizant that access for disability needs does not just extend to the consumers who are disabled themselves, but also be aware that personal assistants and home care providers may themselves have different types of disabilities, and so they need that access as well. With mobile apps, what we're seeing is that there are often checklists within the app that the provider needs to go through and mark off what tasks they've completed and when they completed them. We recommend that these individual tasks and checklists are not required for EVV. It can be really difficult, it can be really invasive, extremely time consuming, and it's just not necessary. It isn't required under the federal law, and there's really no reason to have this checklist be part of something integrated into the EVV app. If you're under a traditional agency and they are using checklists as a standard form of making sure that the provider gave services that are on the plan of care, we recommend that that's something that is done separate from the EVV mobile app. And of course, just the same with the telephony on mobile apps, we want to make sure that consumers have the ability to access the information for review and approval, as well as adjust and modify those timesheets where necessary without having to get permission from a third party. Now, something that has come up that individuals are starting to use more and more these days are Bluetooth beacons. This is a form of EVV where you are provided as the consumer with a very small electronic device. It's very tiny, it can fit in the palm of your hand, and it does not use GPS. It's simply a proximity device. And so whenever it is near you or your home, it's emitting a very low Bluetooth signal. And whenever your home care provider comes or someone who has a mobile app on their phone gets within typically 15 feet of these beacons, it will automatically ping their mobile app and ask them if they'd like to clock in or clock out of a shift. So these beacons are quite unique. It does require that the home care provider still maintain a mobile device, a smartphone device, as well as that app and data plan. But the beacon is a way to identify what the location is with the consumer without identifying a GPS coordinate and exactly where you're located. These Bluetooth beacons, you can take them out in the community with you so that you can carry them on your person. It might get a little bit challenging at times. You might forget them at times, but it is a possibility. There are also fob devices. These are very small devices, usually about the size of a keychain attachment. And these devices are again provided to the consumer. And whenever the home care provider comes, they will press a button and the fob device will automatically generate a 6 or an 8-digit code when that button is pressed. The personal assistant or home care provider will write down that code, and at a later time, they will share that code with the agency, either through a telephone by just simply calling and inserting it over the phone, or writing it down on a piece of paper to turn in later. It depends on the actual procedures and processes that your agency or fiscal intermediary set up. I have on the screen here 2 different types of fob devices so you can get an idea of exactly what they look like. They're going to look differently. These are only 2 examples. So on the left, you can see a little kidney bean shaped navy blue and white device, and it has a 6-digit code with a big red button on the left. And on the right, we have a rectangular black device with a big red button on the right and an 8-digit code in the screen at the top. And lastly, another type of EVV solution is a web portal. This is just like going online on your computer to a website. You type in the URL, you're going to log in with your username and password. Your personal assistant will have their own username and password to log in, and then you can fill out the timesheet for the week. What I have on the screen is an example of the web portal from California. This is what they're currently using. You can see on the left-hand side is the days of the week. The first column has the start time that you enter. The second column has the end time. In the third column, there's location. In here, you can choose home, community, or both. That's the way California has it set up. It can be set up in different ways. And then in the final column, you can see the total hours worked for the day. It has a tally total at the bottom for the timesheet. And you can see the buttons at the bottom are very simple. It's either approve timesheet on the left or reject timesheet on the right, so that you can either make changes through a rejection or approve it and submit it through the approval button. Now, something to keep in mind when it comes to web portal timesheets is that CMS, Centers for Medicare and Medicaid Services, put out guidance last year that stated that web portals are not an acceptable form of EVV. I'm sharing this with you today because it is a form of EVV. It is being used in various ways. The state of California is currently using it, as I mentioned. There are other vendors that are using different types of web portals, and they can be used for different things. So instead of using a web portal solely to clock in and clock out, there is an opportunity to use the web portal as the review device. So if you have telephony visit verification or a mobile app, potentially a vendor can create a web portal where all of those visits sync up, and you can go to this website and see all of the clock in and clock outs, and potentially make changes or potentially approve the timesheets. The other reason I mention web portals is because consumers have identified this as one of the most flexible ways to use electronic visit verification. This is one of the preferred methods of EVV within the consumer community. Now, because CMS has said that selecting home or community as location is acceptable and a mobile app without GPS is acceptable, Stop EVV contends that a website or a web portal that uses the same type of methodology is equivalent to a mobile app device. And we are currently working with CMS on the technical side to try to demonstrate that and try to change their guidance. And we hope that we will be effective in that. And I'll be talking about different ways that you can help us advocate with that later on. So stepping back a bit and looking at EVV from a consumer and the provider's perspective, there have been different types of harm that have been identified within the community. So firstly, when it comes to self-direction or consumer-directed services, we're seeing that EVV systems aren't being designed around the values of CDPA. And so a lot of those supervisory roles have been limited or completely eliminated so that consumers don't review timesheets, they don't have the authority to approve timesheets. If you're working or using a CDPA or self-directed service, this is one area of self-advocacy you absolutely need to speak up on. It's your right and your responsibility to review the time that you have available each week, to review the timesheets and the time submitted by your worker. We've also identified that EVV systems, when they were first designed, it was under a traditional agency model where the supervisor was sitting in an office and the worker went to someone's home, and the person that they were providing services to was really cut out of identifying when and who showed up at their house, what they did. And so everything was pushed back to the supervisor at the agency. In that model of providing care, it requires that the consumer and the home care worker physically be together and present. And for many home care services, that's still the rule today. Under consumer-directed services, the consumer and the personal assistant do not need to physically be together for items on the plan of care to be provided. So, for example, prior to COVID, I would leave my home and go out into the community to work for the day. And I could ask my care provider to go to my home and throw in a load of laundry and start preparing dinner. So when I got home, things were prepped and I could just get started into my night routine. There are different ways that consumers identify how to ensure that their worker did show up on time and that they're doing the work necessary. Everyone has a different method. Personally, I liked requiring my personal assistants to take a photograph of the clock on my microwave in my kitchen so I knew what time that they were there when they first arrived. There's lots of different ways that this could happen. So with EVV, most models require that the consumer and PA be physically together. We've also recognized that some of the technologies and some of the rules around electronic visit verification force consumers to stay within their home. So they're not going out into the community as frequently, either because those rules require them to stay at home for the duration of a shift, or because they fear that if they left their home, their care provider might not be paid. EVV also forces consumers and workers to pay for many of the technologies. Under some circumstances, agencies and states are providing consumers and workers with the technology. So in Ohio, for example, the state has provided everyone with a refurbished military-grade cell phone that only has a mobile app for EVV on it. Here in New York, I'm not aware of many agencies that are providing this technology. And so the burden, the financial burden, falls on the consumer and the care worker to pay for data plans, smart devices, computers, landline telephones, etc. We've also recognized that privacy rights, what I talked about under HIPAA, is sometimes violated through EVV. There are sometimes breaches of the information when it's transmitted from the EVV device to the third party collecting the information. The information can be, reviewed by people who don't have the authority later on. So that is a concern that has been identified. There's also a lack of accessibility to this technology. Unfortunately, this technology was made under assumptions that the people using it, the end users, don't have accessibility needs. And so right now, EVV vendors are really playing catch up to make sure that their products are accessible for a wide variety of disability and access needs. We're also seeing in the community already in areas where EVV has been implemented that workers are losing wages and the quality of care that consumers are experiencing declines because of EVV. And there's a lot of different reasons for this. Some are related to that geofencing that I discussed earlier, where individuals are required to stay within a perimeter around the house. And if you leave that perimeter, or sometimes the technology doesn't work accurately, so you might actually be home and be within that boundary, but the technology doesn't recognize that. And some EVV vendors have it set up that should it clock in outside of that geofenced perimeter, that shift is not paid for, and you need to go back and review it before payment will be provided. Some other issues that is leading to loss of worker wages and decreased quality of care include EVV systems that just don't function the way that they ought to, where it might take excessive time to clock in and clock out. When EVV was first being implemented in many areas, we heard stories of telephony not working properly. Either the individual IDs that the home care provider received isn't being accepted by the system, and they needed to sit on the phone with customer service. And this ate into the time that they were able to provide care because it's part of their shift, as well as the time that they weren't getting paid sitting on the phone with customer service. So we wanna really be aware that there are these possibilities out there, and that should they occur, that we're advocating for fairness in wages for our workers. And also some harm that we've seen are home care workers leaving the industry for other jobs. You know, they can get a better wage, a higher wage with benefits in a different placement that doesn't require them to disclose their personal information or where they're at all times when they're in the community. Now, I have up here on the screen some survey results from a National Council on Independent Living, a NICL EVV impact study that we conducted. Full disclosure, I am the co-chair of the NICL EVV task force, so I did have a hand in this study. We conducted this survey last year between August 14th and November 13th, and we received 468 individual responses. These came from consumers, home care providers, independent living center staff, and various different types of individuals that are somehow impacted by EVV. Those respondents represented 36 different states. And what we found was that 52% of people who responded to our survey were currently using electronic visit verification. Of that 52% that were using EVV, we identified that some individuals were using what we consider to be invasive components. Invasive components, again, is GPS tracking, we found that 56, almost 57% of EVV systems were requiring GPS tracking, 17% required biometric use, and 15% were using some form of geofencing. On the left-hand side, you can see a printout of a call to action that Nickel released that we are still using that talks about GPS, biometrics, and geofencing. It talks about our need to push a federal bill that helps to ensure the right to privacy from invasive and unnecessary use of these components. And this is something that I can share with Jose and Jessica to provide to participants after the meeting. Here is a bar graph showing the impact of EVV use that we identified through this study. So last year around this time, 70% of individuals said that their EVV system does not function the way it was designed. So these are folks that were sitting on hold with customer service for excessive waits, or the mobile app that they were using did not actually clock in or clock out when they were pressing the buttons. So that's a very high number. And of course, the more we get into implementation and the more we talk about the concerns and the issues we're experiencing in our home with EVV to our agency or fiscal intermediary, the more we can get this number of the system not functioning properly down to an acceptable rate. 72% of individuals who responded to the Nickel survey said that they felt like a criminal because of EVV use. This psychological impact of EVV is not something to just brush off carelessly. It's really important to fully understand the impact of EVV, not just on a day-to-day basis, but how individuals who are required to use these systems are feeling about themselves in relation to the community, in relation to the services that they receive. You know, this is going to lead to other types of impact later on down the road. 47% of individuals said that they felt the quality of service that they received declined after EVV started. 37% of individuals identified that they were staying home more often than they had before EVV had been implemented. This is a really concerning figure for us. This is, you know, well more than a third of folks who are isolating in their homes because of EVV. You know, because either they fear that their provider won't be paid if they go out into the community, or they're not understanding the rules around their home care program and the EVV and their ability to go out in the community. Either way, we really want to be aware of this. You know, the disability community has fought long and hard to have access to our community. We still continue to engage in that fight for equal access to our community. So having a program that essentially forces you back into isolation and back into your home it's not good. We also noticed that more than a third of individuals identified that they lost a home care provider after EVV started. This figure is very high. This is something that we anticipated prior to EVV implementation. Multiple other surveys for the provider community, not just through this Nickel impact survey, have identified that EVV is one of the primary reasons that individuals leave this industry. We find that the provider loss from EVV is the same between folks who are new to home care services, as well as people who have put in more than a decade into the industry. 13% of people last year identified that there was already a HIPAA violation, so their personal health information had been leaked in some form. These are things that my work through Stop EVV, we noticed almost immediately in 2018 when Ohio started using electronic visit verification. We have seen some mobile apps where the consumer's information that the provider sees when they log in shows all of their personal health information, their Medicaid ID numbers, social security numbers in some instances. We've also seen it where they have access to consumers that they don't work for. So these are problems in the system that an EVV vendor can fix and is legally required to fix. So anytime you experience some sort of HIPAA violation or you feel that your personal information is being provided more than what you're comfortable with, is a moment for you to speak up and let your agency or fiscal intermediary know that they need to start engaging with the EVV vendor to modify and repair those problems. More than 11% of the nickel respondents identified that there was an ADA violation. And this includes whenever the EVV system is not accessible for different types of disabilities. So what we see most frequently are telephony visit verification, where someone calls in on a phone and they require voice verification. So they're actually using your voice to compare to what they have on file to ensure it's the appropriate person. For a lot of people, you know, their voice changes over time throughout the day, from day to day. They might not have the ability to use their voice. We also have issues with folks who are deaf or hard of hearing who can't access this information equally. On a mobile device, we have seen problems with the EVV app communicating with accessibility software that's on the smartphone for individuals to be able to access and move around the mobile app. So there's a lot of different types of ADA violations. This also extends into folks who have learning disabilities or other types of developmental disabilities, and anywhere there is an issue accessing that app because the vendor did not take into consideration disability needs. And lastly, on this bar chart, we see that 4% of individuals last year became institutionalized because of EVV implementation in their home. These are people who were living in the community using home and community-based services. Their personal care service program was working well for them. And after EVV was introduced for their personal care services, they either lost providers or they couldn't hire sufficient providers to cover their shifts, to the point that they couldn't stay in their home safely, and they were forced to go into a nursing home or another type of assisted care facility. We're extremely concerned about this figure. We are monitoring this closely. We unfortunately anticipate this figure to rise, especially now that we are running into issues with COVID, as well as federal concerns about funding home and community-based services appropriately moving forward. So what is the EVV timeline? What are we looking at? We've been talking about electronic visit verification for years now in the community, and the dates keep getting pushed and moved around. One of that reason is because the community was successful. Disability advocates did lobby Congress to change the implementation deadlines. And so here are the implementation deadlines that currently exist in federal law. For personal care services, which include consumer-directed services, implementation deadline is January 1st, 2020. And for home health care services, it's January 1st, 2023. Now, you might be thinking I have an error here on the screen with the personal care service implementation deadline because that was a year ago, almost. And we are now talking about implementation for January 1st, 2021. So what happened was that we pushed back the deadline to January 2020. And at the same time, Congress gave CMS the opportunity to apply what they are calling good faith effort exemptions. The good faith effort exemption was a 1-year delay in the penalties that states will receive if they don't have EVV implemented by the deadline. So that's why we're now working with the deadline of January 1st, 2021. We're actually working on that good faith effort exemption deadline. So the penalties that I mentioned are that states that do not have EVV implemented by the deadline will receive funding from the federal government taken away for their Medicaid programs that are not using EVV appropriately. This is going to start off at 0.25%, and it can raise up to 1%. And I have on the screen here 1% of FMAP. That's the federal medical assistance percentage. That is just a technical term for the amount of money that the federal government pays to the state to provide Medicaid services. So partial funding for Medicaid comes from the federal government and another part from the state. So the money coming from the federal government is kind of on the line here, that they are threatening to take away some of that federal funding for Medicaid services if EVV is not implemented by January 1st, 2021. And regarding the good faith effort exemption, I think it is interesting to note that every state, except for one, applied for and received this good faith effort exemption. Tennessee was the only state that did not receive or request an exemption, and that's because their state had EVV requirements on the books for the last decade, so they've already been up and running using these types of systems. I want to shift focus now to talk about how to engage your agency or fiscal intermediary to advocate for electronic visit verification solutions that work for you. So to start, I want you to engage with them with an understanding that there's only so much your FI or agency can do. This is a federal law. They are required to implement EVV. The state is required to implement EVV. So there's not a lot that you can do in terms of not requesting to use EVV or having paper timesheets in lieu of an electronic system. But there's still a lot that you can do to make sure that the system that's chosen is something that's going to work for you. So first of all, I want to go back to that stakeholder engagement session. Your fiscal intermediary or agency is required to have stakeholder engagement sessions that incorporate consumers as well as home care providers when they are selecting and choosing EVV solutions. You can ask for specific types of EVV that work for you or work for others that you know. You can reference the different types of solutions I've talked about today. You can provide feedback to your agency or FI about the EVV components that don't work for you and explain why, so that they can try to figure out a fix around and find something that does work. And you also want to hold them accountable to the law and to consumer needs. So if they're not having those stakeholder engagement sessions, really push them to have those. Another way that you can get involved with stakeholder engagement sessions is through a fiscal intermediary consumer advisory committee. These are quite common, so hopefully your fiscal intermediary does have a committee that you can join so you can talk about EVV and other things. I also want to go back to that list of items that are in the Cures Act that are required to be done that we often don't talk about. So again, consulting with stakeholders, making sure that the EVV systems are minimally burdensome, and existing practices that they need to take into account. So there are 2 different best practice guidelines that have been developed by consumers. One is from the Consumer Directed Personal Assistance Association of New York State, CDPAP. It was developed in May 2018. And then a second one was developed by Concepts of Independence. That was developed, I believe it was May of 2019. So these 2 guidelines are out there. They talk about different ways that you can make systems more user-friendly for the consumers, and specifically talking about consumer-directed services. You also want to advocate to make sure that your privacy is being protected and that there's an opportunity for training for both yourself as well as your personal assistants or home care workers. Here I have 3 images of different folks that are holding signage. We have been running this ongoing campaign. This is going to launch really in line with the next bill that we're supporting that I will talk about briefly in a moment. But you can see on the screen 4 different individuals. One's a personal assistant, the other 3 are consumers of home care services, and they're all holding signage that advocate for their rights as consumers and personal assistants, as well as to ensure that EVV does not harm folks. So if you want to get involved but don't have a lot of time, this is a really quick way to do it. We have these signs that you can download on our website at stopevv.com, and you can send in a photograph of you holding signage of your choice. So talking about different advocacy types, right now, Congress is really stalled moving legislation, but there are 2 different bills that are moving forward. One of them is going to be a little bit more difficult to get through. This is the COVID Recovery for Seniors and People with Disabilities Act. So we are still requesting that folks call into Congress, let them know EVV is important, and they do want to see this bill moved forward. And the other is the Cures Act 2.0. And that's going to be introduced hopefully next session in the spring. So the COVID Recovery Act does a lot of different things, but one of the things that it does do is it delays EVV implementation until 6 months after the national health emergency ends. So once COVID is over, EVV implementation wouldn't be able to go into effect until 6 months later, essentially giving states the time that they need, that they've lost during COVID, to make sure their EVV systems are acceptable. This is Senate Bill 3740 and House Bill 6951. This delay is just another opportunity for us to work on getting those other invasive components out of EVV. And one of the good things about this delay is we do have support from larger organizations, including the State Medicaid Directors Association. Many states are advocating to delay EVV further so that they have ample time to make sure that their systems work well. I have here on the screen just some asking points that you can talk about. So, you know, making sure you ask your senators or Congress members to demonstrate support with essential home care workers, making sure they assist states to focus on essential activities related to the health and safety of citizens and not EVV. You know, it's really foolish right now to cut the funding for Medicaid during this pandemic recovery period. And it's really important to also note that a delay doesn't stop states from implementing EVV. They can still choose to do that. I have here just different ways that you can contact your senators and your House representatives. I'm going to skip over this for now in the interest of time. We're also requesting that you use Twitter. So I will provide this presentation to folks at the end. So you can use these links to go on Twitter and tweet to your Congress members. And finally, the last advocacy action that we have is related to Cures Act 2.0. So the disability community has successfully gotten in the next iteration of the Cures Act a section to remove geo-tracking, GPS, and biometrics from EVV systems. So we're encouraging folks to contact their representatives when Cures Act 2.0 comes up to state that you support the removal of GPS and biometrics from EVV. Now here on the screen, I have 5 different check marks. The 2 that are green, again, are the ones that we have successfully gotten into the Cures Act draft as of now, prohibit GPS and prohibit biometrics. The other 3 are ones that we're still attempting to get in there. So permitting web-based timesheets, exempting self-direction or consumer-directed services, as well as exempting live-in providers and other congregate care settings across the board. This is not something you have to do. It's just something that if you feel like it, if this speaks to you, these are different ways that you can advocate to change EVV right now. So once again, we have the COVID Recovery for Seniors and People with Disabilities, Senate Bill 3740 or House Bill 6951, Cures Act 2.0. And of course, the very best way that you can get support for EVV changes is to talk to other consumers and your personal assistants or home care workers about EVV and what can be done. And lastly, up on the screen, I just have my contact information. You can get a hold of Stop EVV through our website, stopevv.com, or emailing help.stopevv@gmail.com. We're on Facebook, Twitter, and LinkedIn, and we do have various EVV support groups on Facebook that you can join. So thank you once again to United Spinal and BCID for having me here today. I hope that this was something that you gained some useful information out of, and I will certainly provide this presentation and some other materials to go around to participants today after this session. Thank you so much.